There are two different types of strokes. The first one is ischemia reperfusion, right?
Yes.
And then the other one is, what is it called?
Hemorrhagic.
Okay. So what's the difference? And you also have a patient that falls into the other category, right?
Sort of, yes.
Okay.
So the hemorrhagic stroke usually is because of prolonged high blood pressure. And what we really think is it's because of a rapid rise in blood pressure. Maybe prolonged exposure to high blood pressure causes those vessel walls to weaken. And so then they're more susceptible to a high, quick rise in blood pressure. So it's less because of the 140 more than it is because of the sudden rise from 140 to 200. Right. And so this vessel that's already a little fragile, can't handle it and ruptures.
Okay.
This particular patient, the problem was that he had a traumatic brain injury and had a bleed. So similar to a bleeding stroke, he had, injury to the tissues because of the rupture of blood vessels.
Okay. And so did you treat this individual pretty much the same way, or do you go about it slightly different?
So this one was a couple years out from his event. It was actually a car wreck, and he was in his 80s. So this is a different patient altogether from the original one. And so we knew already that he had very mild cognitive impairment to begin before the event. And then following the event, he was somnolent, wasn't even communicating with his family, was very quiet, was not really engaged. Before the event, he was doing his own finances, online things, taking care of the checkbook. But he, after the event, couldn't do any of that himself, couldn't shop for himself, manage his medications, became very caregiver dependent. And so in coming into contact with me through with peptides, we started to treat him, and we started him also with cerebrolysine. We also did IV with him, but our next treatment, he actually got a great response to the first IV, and then really great response, was awake, was interacting with his family and communicating well. And the second time we gave it to him, he didn't have any response that was obvious to the family. And so we decided to change course and put him on topical dihexa. And dihexa is fascinating, I think, because
I love it.
It really, have you used it?
I have 25 milligrams on my neck, and I rubbed it on the side of the neck close to the jugulars and the carotid and all that sort of stuff, so I'd get more of it, I thought. Literally, you feel like you feel better, you feel awake, you feel just brighter. It's very good stuff.
I've only used it I used it for about a week, and I did on my forearms, and I didn't have any event, so I need to try it on my neck next time. I had a patient who came in who needed it, so I said, I'll just give you mine.
Yeah, that was nice of you. Yeah. So did that help? Did that help him? Did the dihexa help him?
Yes, and so this patient now, and it's sort of helped him, yes, in a great way, but not in a great way for his family, kind of. So he started the dihexa and got to be so cognitively intact that he started going back and doing his own finances again, looking at the books, seeing what was going on. And then he said, oh my gosh, what are we spending all this money? Who is TaylorMade?
That's funny. Yeah.
And so he's now very irritable. And you know how patients with mild cognitive impairment have a tendency to be a little
agitated, easily agitated. My dad got that. In fact, my father even got that phenomenon called sundowners, where at night they just become so agitated.
Right.
Yeah.
And this guy in particular he decided to fixate on the fact of how expensive the peptides were, despite the fact that he is, weeks before was unable to do this, and now he is able to, wasn't putting it all together, but still was able to see that there was a problem with his finances that were, so this is our debate now, is do we take him off the dihexa, or do we keep him on it and push through the aggravation? He also did a trial. Before we did dihexa, we did C-Lank on him.
Oh, yeah.
And he did not tolerate the nasal spray. It gave him nightmares. So we switched him over to the sub-Q injections, and he did get some maintenance of that initial response to cerebrolysine from that, but then just wasn't quite getting as much as we were hoping for. So we added the dihexa after that.